Good.
Okay. Welcome everybody to this month's Earth Exchange Cafe. I hope that you've brought your cup of tea or hot chocolate or whatever it is that you have brought with you to the cafe so that you can settle on in and enjoy another beautiful, beautiful conversation with another guest. So I will open the proceedings by inviting you into the cafe. And if you close your eyes for a moment, remember that you are back in that place, your favorite cafe with beautiful music that's inspiring from what some of the wonderful, wonderful people we've had conversations with. And on the tables are magazines and articles and books from fantastic speakers and writers and academics that we've spoken to over the years. On the walls is art, tapestries, all sorts of beautiful creations that reflect the woundedness and the love of land that we all share. And we sit there in our favourite chair and we prepare ourselves for what is to be a beautiful conversation, a challenging conversation, a rich conversation between Trebi and our wonderful guest, Joanna Burgess. So without further ado, I pass it over to Trebi.
Thank you, Harry. So, of course, as you know, Earth Exchange Cafe is our monthly program. We've been doing it about a little over 3 years. And we have conversations with really interesting people who are not afraid to face the hard places and the hard times, and who do so with art and practices and teachings that are beautiful and life-inspiring. And we had a conversation a few weeks ago with the idea that maybe we would also focus, we normally focus on how this work affects the earth, the land, nature, but how does it affect also people who have been through hard times in their life and come back out of it with beauty and affirmation? And so our first guest is Joanna Burgess. Joanna is a nurse at ConvaTec, which is a company that creates technologies and products and support in the areas of advanced wound care and ostomy care, continence, and infusion care. Before that, she worked at Wake Med Health and Hospitals in Cary, North Carolina, and her specialty was in wound care. Ever since her own life and that of her family changed radically when she was 3 years old, Joanna has known that she wanted to be a nurse, and she's dedicated to helping those with bladder and bowel ostomies and other serious wounds to live healthy and even joyful lives. She was the recipient in 2011 of the National Great Comebacks Award, and she shared her personal story on state, national, and international levels. Joanna was also one of the founding members of Radical Joy for Hard Times, and she served on its first board, and she lives in Apex, North Carolina with her husband, Ross Stocks, and their little tiny dog named Duke. And I have known Joanna for 20 years and am always inspired by her. So we are very, very happy to welcome you, Joanna.
Thank you. It is finally time that I made it here to the cafe. So delighted to be here with you, Trevi, and Harry, and everyone who's here today. Thank you.
It's great to have you here in the cafe. So let's start with that story of what happened when you were 3 and you were this lovely, perfect family. And then everything changed. What happened?
So if you can imagine, I grew up in a beautiful place in upstate New York between Saratoga and Lake George, if people know where that is. Just the Adirondack Mountains. My father was a minister, a Methodist minister, and he had just been called to the Methodist church in this little town of upstate New York. And so we were a young family. My mother was a new kindergarten teacher, my father a brand new minister. I was just a little over a year old. My sister was she was on her way to kindergarten. And so we were happy. We were new. We were just brand new and getting started out there. And and journeying on as this new family. I have this picture of my sister and I have always been called to this picture. I keep it out. It was in a scrapbook for a long time. And that picture, and I'm going to explain it, sums up to me what happened and how my life changed. So it is my third birthday. I'm about to turn 3 years old. I have 3 little cupcakes standing on a stool, on a plate, and my big sis is next to me, and she's about ready to help me blow out those candles. So I have my birthday. 3 weeks later, I would be diagnosed with a very rare form of bladder cancer. My family, I grew up not knowing the name of it, but later when I became a nurse, I would discover through my medical records that it was called a rhabdomyosarcoma, which is it's a very aggressive tumor that invades the soft tissue. So I look at that picture and I look at that time as my pivotal moment. There is a wonderful advocate. She passed away about a year ago by the name of Tiffany Christensen. And she has this book called Sick Girl Speaks. She herself had been through many difficult and dark times in her life with cystic fibrosis. She had had 2 double lung transplants. And one day in that book, I read her words that said, there's a pivotal moment in everyone's life when you are no longer headed in the same direction that you were even moments before. So to me, that just sums up that moment, that picture, turning 3 years old, and everything would change from that moment forward with such a significant diagnosis. I was told that if I survived, well, my parents were told if I survived and did all the recommended treatments, which were pretty harsh. It was investigational chemotherapy, high doses of cobalt radiation therapy, which is a different form of radiation than what we do today, that I might survive until the age of 6. So I celebrated my 60th birthday 2 years ago. So I'm so happy to be here with all of you. So, Trevi, that's kind of where it all started.
That's where it started, and it's ongoing. And what I've always been struck by with your story is how, as you know, as shocking as it must have been to be a 3-year-old going through all that, you got inspiration from those nurses, and you've never wanted to be anything other than a nurse. So what was it? What do you remember about those nurses and about what they were doing or how they responded to you and that whole environment that made you say, this is what I'm going to do?
I have such keen memories of a 3-year-old being in the hospital. It was Boston Children's Hospital. And back at that point, it would have been 1965. There were large wards. So children would be with other children in one room. And the nurse, Miss Russell, I don't know whatever happened to Miss Russell, but I remember watching her scurrying around. I remember my father saying how efficient she was. She would get us all bathed. She would get us out of our bed. We would sit at little tables. I remember the Hawaiian punch and the red jello. You know, there are so many things, but I'm also a pretty sensitive person. And my father describes to me some of the other children when he was alive. There were children who had been through burns. There were children who had been significantly burned and who had cancer. And having studied energy healing work, I think I was absorbed from all the emotions and all the feelings that were going on with the other children in the wards. So not only the nurses, and I can distinctly remember what the beds looked like. They were little cribs with side rails. Just absorbing everything that was going on with those children and the nurses, and my living memories that I still have of what all that felt like. So I think in a way to try to understand it, all I wanted to do was be a nurse. That is all I ever played growing up was nurse. I played nurse. And I had a very elaborate hospital set up in the basement of our house with little beds all lined up, little cribs, little beds. Some of the beds I made. I would make elaborate oxygen tents for some of these stuffed animals with saran wrap. I would take tubing from my father's workshop, connect it to bottles. I put red paper in the bottles to make it look like they were getting infused with blood. Each of my stuffed animals had a medical record or a chart with their temperature and their blood pressure and their pulse. I mean, I knew how to be a darn good nurse right back from the get-go. I learned how to be efficient and thorough from that Nurse Russell from so long ago. So it was infused into my being from the age of 3. I really believe that.
That's just remarkable that you remember it so well.
I do.
It really is remarkable. So what were you like as a child, besides being in your basement and having an elaborate and very excellent nursing care system?
To my stuffed animals. I was very curious. That was the beginning of my love of nature because we were in such a beautiful environment. I grew up along the Hudson River. We had beautiful lilacs in the spring, and I remember making houses under lilac bushes, and inviting my friends into the secret spaces that I would make out of those lilac bushes. I remember the smell. I remember going to Lake George, but I also was doing all of that in pain. The radiation therapy literally burned my back. We didn't realize at the time, back in 1965, in the 60s, early 70s, children weren't followed after cancer therapy like they were today. I had pain in my legs. I had pain in my bones. We didn't know why. And I didn't talk a lot about it. I just tried to keep up with the other kids. But that was all I can look back today was a symptom of the radiation and the chemotherapy. So in the midst of trying to physically carry on and do everything that other kids did in school, I would run away sometimes and hide under my lilac bushes and just come into myself and rest. It was my resting place. Nature became my resting place and my recoup place. And I often loved to be there under those lilac bushes just by myself, just to rest, because I didn't have a language about what was happening at that point.
So I've heard you say more than once that when people are faced with tough situations, they either run toward them or they run away. And you've been the person who runs toward. So could you tell us more about that and about how you've run towards your own situation and anything else?
Yeah, and I really didn't recognize the significance of how I ran toward things to better understand it until I was older. When I look back at my life, I began to see, oh, I always ran toward what had happened to me as far as having had cancer instead of running away in an effort to understand it. And I think that's what part of becoming a nurse was all about. My first nursing experience was at Duke University Hospital in the pediatric ward. And I can today see that that was a way for me to understand what my parents went through, what I went through. I was working with little kids and school age kids who had significant cancer diagnosis. There was a lot of death and dying situations. We lost many of our patients to death. It was watching what those parents went through and what those kids went through and what did all that mean and what did that mean for my own life and what did that mean to my own parents and my sister, and how do those dynamics of a very sick child change the dynamics in a home? How do we all see it very differently? So I gleaned a lot of information by being a pediatric nurse and watching those experiences. And then as side effects began to happen to my body, I developed from the radiation therapy a leg that began to swell and swell and swell until my leg, when I was began to happen in high school. And by the time I was into about my second year of nursing on the pediatric floor, my leg was twice the size of normal. And again, nobody could really relate that to what was all that about? What was all that about? I was beginning to not be able to eat very well. I was not digesting food. I was about 85 pounds at about 4'11". So I was getting thinner. My leg was getting bigger. What do I do with all of that? And I was also getting wounds. The burns on my back suddenly broke out into this huge wound. And I recognize it now as a wound care nurse as a pressure injury or a pressure ulcer that had developed after a long car ride from pressure against my back. So I had to step out of nursing, traditional nursing. I had to leave the pediatric floor that I loved. Today, I can see that I again ran to nature. I didn't consciously know what I was doing at that time, but I wasn't ready to face a lot of surgery and procedures, which was about to happen. So I had a mountaintop experience. I found a nurse in Honduras, and I went to Honduras and did some nursing with her. But I got more than probably I gave because I was surrounded again by the mountains. I was surrounded by giant flowers that they grew in the mountains. Just the coffee that they grew in the mountains was beautiful. And I felt restored by nature to come back and do what I needed to do. So I had 5 major surgeries over 12 months. I had to have back surgery. I had to have skin surgery to repair the wounds. I had to have bilateral hip replacements. I had to have bypass surgeries to restore the blood circulation in my legs. And I ended up having, after my original surgery, I had an ostomy, a urostomy, which replaced the bladder that had to be removed when I was a little girl. And I had developed radiation colitis, so I had to have a colostomy. So I took each one of those things. I had to step again away. I couldn't do traditional nursing. So I decided to investigate each one of those things. So I became a massage therapist as I was recovering, a sit-down massage therapist. So I went to massage therapy school, where it led me to the path on the treatment for lymphedema. And I discovered that this leg that was twice the size of normal, there was something that could be done about that. I had never heard anything from traditional medicine about what to do with that big swollen leg. So I studied the treatment of massage and lymphedema. I went through the treatment myself. And then I started a lymphedema clinic as a volunteer with a physical therapist. So that was one journey that I took. So running toward it to better understand it, to first take care of myself so that I could understand it to take care of other people. And then the same thing when I realized that the treatment for lymphedema was very physical. It involves a lot of bandage wrapping and large limbs and shrinking large limbs. It's very physically demanding. I decided it was time to talk about something that people don't talk about, and that's having an ostomy. So I was living in the world with 2 ostomies now, a colostomy and a urostomy. So I decided to go to school to learn about how do you help other people take care of their ostomies. So at that point, it was a tri-specialty. So I learned how to be a wound care nurse, as well as an ostomy nurse, as well as a continence nurse. And so again, running towards something to better understand how it affected my own body first. So that on every level, not just a physical level, but emotionally, spiritually, in order to help other people with wounds and ostomy and continence issues, which is where I am today.
Yeah. Harry, are you there? Do you have any questions? I'll press on. Yeah, so that was I was going to ask you about how you suddenly began to tell your own story, because I think I knew you then. There was you had already been like healing yourself and learning how to do that as a way of healing others. But then there came this, then you started sharing this story. So was there something in particular that inspired that, a particular incident? And then what happened as a result? I mean, including the award you got.
Yeah. So the first place I learned to tell my story was actually back on that pediatric floor. One day, a little boy arrived on the floor. He was quickly diagnosed with rhabdomyosarcoma of the bladder. He was 3 years old. So again, my very good friend, who was also a nurse on the floor, she was the first person, when you have such significant physical changes in your body, you need somebody that knows to feel safer in the world. And my best friend, Nancy, knew what had happened to me throughout my whole life. And so she kind of nudged me in the elbows and said, "Hey, I promised that I would never tell your story for you, but I I just had to tell the mother of this boy about you, and please don't kill me." And I'm like, "Thank you, Nancy. It's time to tell my story." So I did. I went in, I spoke with the parents, I explained who I am, and it was perfect because first they knew me as a nurse. You know, they couldn't see my pouches, they couldn't see my ostomies. They had thought that their little boy's personality, that he was never going to be him again. And so meeting me first as their nurse and then telling my story was a significant piece of that. And then one of the things that introduced me to you, Trevi, was there was a vision quest that came along called Facing the Mystery. And it was about working with a group of people who had faced life-altering illnesses and going to our mountaintop, which was Evergreen, Colorado. You had put a program together with other people who had faced significant physical challenges. So a group of us went to our mountaintop, and I think it was having a shared experience, although not the same experience, with a group of people who had faced such darkness physically and had had such trauma in trying to tell their own stories about what had happened, because there begins to be a stigma about, especially in the ostomy world, there's a stigma. How do you talk about it and how do you share that with people? And so having this commonality with other people on a mountaintop, using nature, realizing how nature can be a symbol for your life, to share that experience was really groundbreaking for me. To be able to get out, you suddenly feel big. You suddenly realize that you are not your illness. You are still the same person that you ever were and ever are. And that essence is there, and you can tap into that essence through nature. And I've shared this with you, Trevi, that one day we were taken up very high into the mountains where there were a grove of trees called the bristlecone pine trees. And I remember thinking when I saw those for the first time, those are the stubbiest, ugliest trees I've ever seen in my life. And it was cold up there. And why are they taking us to this cold place? And all you said was just sit with the trees and see what they have to say. And I realized that those trees were my symbol for the rest of my life. They were going to be my symbol, because those trees are the oldest trees, one of the oldest trees in the world. And they bend and they reshape themselves. They're very resilient. And that's why they live so long. They're survivors. And that is why those trees became a symbol of my life. And so taking that component of nature and that common experience with other people, telling my story for the first time on the pediatric floor, meeting my husband, there's something about someone falling in love with you for the person that they see. It's not about falling in love with anything about your illness, you know, anything about that. He tapped into the joy essence of me, fell in love with me. And so I had this firm foundation. I'd had these lifetime experiences, and I would say that the real clincher was Ross, my husband. I had that firm foundation to go out and tell my story. So it was all of those things put together. The safety of having that person in my life was the final push, pushing myself to go out and do that.
And I just want to say, for those who don't know the bristlecone pines, they are one of the oldest beings on Earth. And as Joanna said, when you first see them, they look like just sort of, they might have short, stubby stumps. I don't know, maybe 4 or 5 feet tall. And then it's just kind of like all this thick, dead stuff. But then if you spend time with them, you see that maybe there's one branch that's just bright, alive, brilliant green. And so they're very inspiring. They find new ways to grow and be fertile and survive, even though huge bunches of parts of them are gone. So that was why we wanted to bring people up there to see them.
That was perfect.
Harry, do you have a question that you want to ask Joanna?
I'm wondering about the reluctance to engage with the tree. And can you tell us a little bit more about that? Because it feels like there may be something in there about when you're dealt something that is really something that you don't want to engage with. How did you work through into that relationship that felt more healing?
And Harry, I love that question because it gets right to the heart. And when I know something's right on target, I start to get a little teary right here. I think it was because I felt what everyone felt, ugly. I had, I have always tapped into my essence of joy, no matter what. But there was something about my physicality that had an ugly place to it, a place that you couldn't go to, you couldn't talk about. There was kind of a message from my family that you kept it a secret. I remember, and to my mother's, not anything bad against my mother. In fact, in many ways, it helped me. I remember her teaching me how to go to my first slumber party for the first time, and how to change my clothes into my pajamas so that nobody would be able to see the ostomy or the urostomy. And so, there was always this message, and people today have this message too with an ostomy, is that that's not something you really share or talk about. And so seeing the tree and feeling that place inside of myself, that whole, and I just thought of this right now. It's the trunk of my body where the injuries happened. And we were sitting with the trunks of the trees that were twisted and appeared prickly and twisted and bent. And that was my trunk. That was my core, my trunk that felt ugly. And that just occurred to me right now, Harry. So thank you. Thank you for the question. That's beautiful.
Yeah.
Yeah. Yeah. For me, it adds a whole nother component now to the bristlecone pine and the meaning of how significant that mountaintop experience was. Thank you.
Yeah. Oh, gosh. And I think I'd love to hear more about what you said about that reluctance to talk about it as well. That your mum, with all that care and love of your sense of pride of fitting in as a young person, you don't want to be different at a slumber party. It's all rooted in that sense of love, and how that expands to the professional world and the nursing on the ward. Like, how do you have those conversations, and how can you bring the mountaintop down into the ward? And I'm really curious about how your work has been going in that direction?
Yeah, so when I won the Great Comebacks Award, um it was an award for being able to go to that place and be an inspiration to others who had been to a similar place. Like, you're right. How do you take that place that has been so dark and has felt so wrong and has felt so hidden? How do you bring it out into the world? And I remember when that award and the announcement came out in the newspaper. There was a piece in the newspaper about it, and I remember telling Ross, it was the first day I went back to work after that had come out into the newspaper, and it was a pretty lengthy story. And I'm like, you know, people are going to know now, people who have never shared this with, I'm about to walk the floors of the hospital, and how am I going to feel? And sometimes a lot of magic happens when you least expect it. And I remember, kind of feeling a little bit nervous, walking to my office, my phone rings, and it's the emergency department. And they said, there is a woman here in the emergency department with her son. Her son has an ostomy. He's crying and she's crying, and they don't know what to do about it. And she's waving that newspaper saying she wants to talk to that nurse.
Oh my gosh.
Come here to find that nurse. So that kind of triggered everything, and I knew that it would all be okay. And I think what caused it to flourish was that people started coming up to me, asking me, "Wow, you're so incredible," and it just kept giving me more confidence, more confidence, more confidence. So I started sharing my story with more nurses. I started telling my patients that I had an ostomy, which I hadn't always done that before. And there is still something about a patient seeing you as a nurse for the first time and then realizing, oh, under your clothes is all this going on. And look at your life and look what you've done. You became a nurse, you did all these things. You're a joyful person, you got married, and I talk to people from every aspect of, am I ever going to find love again? Am I ever going to be able to do the things that I love again? And what I love, Trevi, that I was able to see, I had the gift of seeing Trevi last weekend. We were doing some great work with some women, and a very powerful sentence came out of Trevi one day that said, this was to the whole group. When did you realize you were still you? When did you realize you were still you? And I feel like that's what I do. I help people to realize that they are still who they are, despite what's going on with their physical body. They're an emotional body, they're a spiritual body. Go out into nature, go on your mountaintop, feel your bigness. You are big, you are the you that you always have been. You can go to that dark, hurtful place. And I often use the term radical joy when I'm working with people with wounds and ostomies, because you can find beauty in the darkest of places, in the place that you never thought you would see beauty again. You can, because something may have saved your life, like an ostomy or a wound. Those are the things that may have gotten you to the place, honestly, for some people to discover who that you is deep down inside. So I do that today too. I reached a point where it became difficult. The radiation still wears on my body. It still continues to change my body. So I reached a point where I couldn't really run around those floors anymore. And so I found my job at ConvaTec, which is working from home. I work in our support nurse community, where we talk with people every day all across the country. And I still do that over the phone. I still help people find their essence, find their true place, despite what has happened or in spite of what has happened to. I mostly work with people with ostomies, people who are about to face surgery, which is, I love that my vision quest was called Facing the Mystery. So I kind of relate that to them. They're about to face their surgery. They're about to face the mystery of what is this all about? So we counsel them. We talk to them after their surgeries, help get them set up with supplies. And then for the life of their ostomy, for however long they have it, whether it's just temporary for a few weeks, a few months, or for the rest of their lives. I'm here to help them find out that true essence inside of them, that it's okay. So it's about helping them get back on track, having these conversations. So it's been remarkable how I can do that on the phone to many, many people a day. And it's been quite lovely and wonderful. And there's a reciprocal, I've always believed there's a reciprocal process in nursing that happens. Whenever I give something out, I always look for what I can get back, because that's what restores me. And that's what keeps me going on this journey. Because honestly, it's not always easy. It's not always easy. People are in crisis and hurting. And it's about, working with a lot of different dimensions, not only physical, but emotional and spiritual as well.
So, and as I understand it, I mean, I know you've also worked with nurses to help them to deal with ostomy, which is maybe not necessarily the kind of nursing that a lot of people say, oh, this is for me. You knew it was for you. But so how have you worked with medical professionals to help them to be with the patients in maybe a different way than they had been before?
Yeah, and that's a great question. That gets into my, I would say that gets into my advocacy work. So I am co-chair of the Advocacy Committee of the United Ostomy Associations of America, because we recognize that taking care of someone with an ostomy scares nurses. It's not something in the nursing curriculum that is mandatory to be taught. So many nurses get out into the field, whether it's a home health situation or a hospital situation, having no idea of how to take care of somebody with an ostomy. And they're frightened. They're very frightened. And so I counsel nurses, I educate nurses about what this ostomy is, how to take care of it. If they can understand it intellectually, then they can go beyond that and help a person adapt emotionally. And so through the United Ostomy Association, to be the voice of this whole community of patients, first of all, there are not enough of us nurses that do this kind of work. And I pride myself, nurses get into this profession for many different reasons. Nurses who become wound ostomy continence nurses are kind of a rare breed. We love working with, the digestive system and, the things that people don't talk about. We love talking about it. We all joke, we can go to a restaurant, eat spaghetti and talk about, things that nobody else would talk about. And so bringing, when something is hard, I always try to bring a lightness to it. And I think bringing my story to these nurses brings a lightness to it, a reality to it. It helps make it real so that they'll be inspired to go out and care for these people as well. So that's part of my advocacy work, is creating tools for nurses, encouraging them to go back to school and talk to other nurses. I've encouraged ostomy nurses to go back and talk with nurses at their hospitals about what it means to be an ostomy nurse, not just to do their work as an ostomy nurse, but how can we inspire other nurses to be ostomy nurses as well, so that we can continue to feed this population of patients. I talk to many patients in my current situation who have never had an ostomy nurse. They might not even know that there's ostomy nurses out there. And so to be able to talk to one and a nurse who really knows about this is sometimes a magical experience for them. It's a wow moment. Like, wow, there is somebody who can talk to me about something that I've never been able to talk to anybody else, even their surgeons. Surgeons do their thing, but they really don't know about the emotional, physical side of taking care of an ostomy. So this is a true revelation for many patients for the first time that, wow, I have somebody to talk to. And also through the United Ostomy Association, our goal is to make sure people know they're not alone. There are about 1 million people living with an ostomy across the United States and about 100,000 surgeries every year. So nobody needs to feel alone at all in this.
Gosh, that's a lot.
Yeah.
Yeah.
It is a lot. It is a lot. And a huge chunk of those people still feel very alone. So it's about finding your people, just like on my vision quest, like, being with other people with life-altering illnesses, but also finding your people that live every day with an ostomy. You get it. It's important to find those people. You don't have to be alone. You do have, in many ways, a shared experience. And so we help them find their people.
I would like to ask you a question about your nature-based healing and the lilac bushes. And I wonder whether there's an experience that you can share, or whether it's something that's come up where you have found that a patient has benefited from nature healing in the same way.
Yeah, it was fun. We have in the ostomy world, there's a camp for teenagers with ostomies, and it's called Youth Rally, and it's for 13 to 18-year-olds. And I got, through my work with ConvaTec, I was able to speak to them for the first time. And I talked a lot about using nature as a healer, because these are kids, kids that want to go out and be a part of nature. They're kids, and they want to have that experience. And so some of the conversations that happened when I told my story to those kids were like, oh, now I can go out and I can camp and I can begin to look at nature in a different way. I can begin to look at it in a way that's healing to me, just like you did, Joanna. And that was just last year. And I would say that was my first, like, wow, I can do that. I can do that. I can go out into nature and use nature as a healer for my life. And it's nice to capture that in a younger population, because they'll be able to use that tool and carry on with it for the rest of their lives. Because we know, as cancer survivors or anybody that's going to live with a physical difference for the rest of their lives, you need those tools at different points in your life, because developmental stages, you're going to reach different things that cause you hurt and pain and sadness, like when you reach the point where you want to be brave and date and have a relationship, whatever that looks like at any different stage. You can now go to nature and use that as a tool through all those developmental stages. So I love that I was able to capture that group in their youth.
So I want to ask you, you said something. So I was in North Carolina last weekend, as Joanna said, doing a grief workshop for a small group of women. And you said at one point, Joanna, later when we were talking, that wounds in people are like wounds in nature. And I wonder if you would say a little bit more about that.
Yeah, I agree. I loved the wound care part of my work because it made so much sense about how we heal when you look at the physiology of how a wound heals. A wound goes through different stages to get to the point that it heals. It often in the beginning looks impossible. Like, how is this wound ever going to heal? It can be black, it could be necrotic, it could just be really ugly. And so you begin to find the ways to get the wound to heal. So you may use medications, you may call in people to help you, like a surgeon, to do what needs to happen to the wound to get it to heal. And then the wound begins to evolve in different ways. So every time you take the dressing off, there's a change that happens. You know, the wound where it looked messy and icky in the beginning begins to drain. And the innate sense of the body also comes in. There's little helper cells that come in and begin to help it to heal itself. And there's little helpers like we call it a scaffolding in wound healing. You know, little helpers begin to climb on the scaffolding. There are cells that begin to fill the wound in. So it's like any wound that happens emotionally, spiritually, physically. It can look really dark and messy and yucky in the beginning. But every time, if you embark on the journey, every time you do something, you go out into nature, you change the dressing, something changes. The wound begins to heal. The wound begins to look cleaner until you don't need the dressing anymore. And you can go off on your own.
I want to find out from Harry if we have some comments on Facebook, but I want to ask you one other thing first that's really important. And that is, of course, we're Radical Joy for Hard Times. You were one of the founding members. What is Radical Joy for you and the way you live it in your life?
Radical Joy is a tool that I continue to use almost on a daily basis because life is hard. You know, things happen in life. Physical bodies are hard. As you get older, things are changing. As you get older with a disability caused from something when you were young, gets harder and harder. So I try to see radical joy every day, whether it's because it's a joy that happens in the deepest, darkest place and in a place that takes you by surprise. So I'm beginning to develop a neuropathy in my leg and it's advancing. There will be a time when I probably can't feel my one leg, maybe both legs. And so I use radical joy to say, I can still go out into nature. I might do it in a wheelchair. I might do it with a walker. I might do it by holding both of my husband's hands. You know, that's what we do. I go out into my shade garden with him in the backyard, and he shows me, he shows me radical joy. Something in the shade in the backyard has sprouted that I never would have thought possible. A blossom, a berry, something. That's radical joy. A surprise, something that keeps me moving forward, something that continues to beckon me despite the changes to keep moving forward no matter what, and to find that.
Beautiful.
I hope it's okay to say you've inspired me to quote Rumi. A small little stanza that Trebi knows. It's called The Hiding Place. The most secure place to hide a treasure of gold is in some desolate, unnoticed place. Why would anyone hide treasure in plain sight? And so it is said, joy is hidden beneath sorrow.
Perfect.
I love that, Harry. You know, I love that so much because my mother was adamant that my middle name would be Joy. And I think she knew something, and we all have an innate sense about something. And so when I was born, my father gave me my first name. He wanted a name from the Bible, being a Methodist minister. But my mother was adamant that my middle name be Joy. And I love that. Thank you.
Yeah. Yeah, perfect. So do we have comments from anybody or questions?
We have comments, and it really is a true reflection of this conversation. Bridget says, I'm excited to hear your shared wisdom. What an honor to be here. And Jane says, you are such a gift, Joanna. And they're the two comments that we've got at the moment, but they usually come a bit later when people watch later. So you can always just pop back and see. And I reflect that too. It feels like an honor, and so much wisdom. Thank you.
Thank you.
Yeah,
Thank
and I agree, and the reason I wanted Joanna to be on one of the founders of Red Joy is because you do embody your own message in such a deep and broad way. You know, it's really beautiful. Thank you.
Thank you. Thank you. Should have brought my little hankies today.
I feel myself welling up a little bit too, and
No,
that's a good sign too.
yeah.
Always a good
So Harry, you want to bring us out of the cafe?
Yes, absolutely. So it is that time. We've come to the end of our beautiful conversation, and our drinks are finished, and the fire in the grate has died down, and it's time to leave. So just before we do, let's just collectively take that breath and allow the conversation, the words that have been said and the unsaid words that have been guiding us, and let them just percolate through us. And then when that has happened, we just allow ourselves to walk out of the cafe, shut the door, and look forward to our next month, where we're going to be in conversation with somebody else. But thank you so much, Joanna. It's absolutely wonderful to be speaking to you. Trebby, who have we got next week?
Oh, we have, let me look for the date. Yes, May 22nd. We have Jess Rasp, and she is a puppet, a maker and a performer with puppets. And she lives in Baltimore, Maryland. And she has done some remarkable work with puppets and extinction and climate change. So that's May 22nd. Joanna, thank you. Harry, thank you. Everybody who's listening, thank you so much. And we'll see you again.
Bye-bye.